Hi, my name's Dee Dee Vergados, and I'm the director here at the Bloom Center for Hypnotherapy. And today we'll be speaking with our pain specialist, Leslie Mitchell-Clark, about the very real impact that goes along with living with chronic pain, such as anxiety, depression, addiction to pain medications, and suicide as a result of having long-term chronic pain. What research is showing us is that most often it is the person who is prescribed pain medication for a medical reason that will become addicted. And according to statistics, it's estimated that 8.5 million Americans currently abuse pain medication, and more people now die from overdoses from prescription drugs than they do from illegal drugs such as heroin or cocaine, making drug overdoses the leading cause of injury of death in the U.S. And this is according to a report from the Drug Enforcement Administration. Stress, pain, anxiety, and eventual depression are intimately related. Being in pain causes stress, and being stressed will worsen pain. A recent survey done by members of a national self-help organization showed us that 50% of people reported inadequate pain relief from their medication, and they identified depression as one of the worst problems caused by their chronic pain. Because of this, 50% reported that they had considered suicide due to feelings of hopelessness associated with their pain. And in actual studies done, 19% reported thinking about suicide, 13% had active thoughts of committing suicide, 5% had a current suicide plan, and 5% reported a previous suicide attempt. 75% of those people had planned to use a drug overdose as a means to end their lives. So Leslie, this chronic pain is a very serious situation, is it not?
Indeed, Dee Dee, it's incredibly serious, and it's serious on all levels, all strata of society. This is not an issue that is confined to low income, high income, men, women. Everyone is coping, well, everyone in pain is certainly coping with their treatment plan. And unfortunately, up to now, the standard approach of mainstream medicine has been narcotics. Now, there is an absolute appropriate time for narcotics. We are not saying that they cannot be appropriately used and adequately prescribed, but the real problems that we're talking about come into view when we're dealing with long-term pain syndromes. And the pain syndrome itself is actually incited by the use of opiated narcotics. And because once you try to remove the narcotic, in fact, whether you're doing and this would be most often occurring if it's an abrupt cessation, but when you try to remove the narcotic, the body actually creates pain to increase the need to get the narcotic and again satisfy the desire.
So it's a self-perpetuating cycle.
It's completely self-perpetuating, and the modern medical establishment is only now just starting to realize that they have been using a Band-Aid effect, and many people, I don't know if it's most people, but many people, after using prescribed pain medication for a long period of time, do not get relief. And so therefore the prescriptions have to be increased and increased and increased to get somewhere near the kind of relief that the person initially experienced.
Okay, so how can hypnosis help people so that they don't have to go through all of these things that are associated with chronic pain?
Well, I think the first thing that is important to remember is early intervention. The longer a pain syndrome, if you will, continues on, the more difficult it is to manage it and get it under control. It's kind of like a circuit, if you will, an electrical circuit that continues to be invigorated by the pain response. So early intervention is absolutely necessary. And what we do in hypnosis is we can allow the body to trigger powerful pain relievers in the form of endorphins, serotonin, dopamine. We can actually, by talking to the subconscious mind, create a release of these wonderful natural pain relievers that we can create really on demand.
Oh, that's amazing. I mean, I didn't even know that hypnosis could create endorphins like that.
We can tell the brain to release a flood of endorphins, not only in general throughout the body, but even to specific areas.
Okay. So what are some other common conditions that you've seen that go along with pain? Because I know we talked about anxiety and depression, and anxiety itself worsening the pain due to the stress. And
Indeed.
again, it's like a cycle.
Yeah.
So what are the conditions that you've seen that go along with pain?
Well, initially, somebody who is not getting pain relief and is trying to cope with these issues would have a high level of irritability. No doubt there would be sleep deprivation, which of course can just eventually cause insanity. Sleep deprivation is a huge issue here. So there's sleep deprivation, irritability, and of course when you are coping with pain, it puts the body in that old fight or flee mode, that old caveman response. So in fighting pain, the body begins to release corticosteroids, adrenaline, and all those very abrasive chemicals which only invigorate the pain and then lead to an incredible stress response.
Okay, so now you talked about people being on long-term use of opiates. If this is the case, how can hypnosis be used in combination with weaning them off of those, or at least lessening the dose?
Well, that is where hypnosis is a perfect complementary treatment to what is going on with whatever the person's traditional medical choice is. So as the prescription pain medication is reduced, when we work with the individual through hypnosis, we can begin teaching them how to release the endorphins. And we can begin to supplant the prescribed medicine with the natural chemicals that our body makes. And it's always a question of gradual reduction. Abrupt reduction of pain medication is never a good idea, in my opinion. It always has to be gradually reduced. And so if you are desirous of living a healthier life and perhaps even eliminating the pain altogether, the most important thing to do is remember that it's a gradual reduction combined with another type of therapy, either hypnosis, and certainly hypnosis in conjunction with reasonable exercise, because also just physical movement will increase the endorphin production. And many people are immobilized by their pain, and not really for any skeletal mechanical reason. They're immobilized because of the pain syndrome itself.
Okay. So now, what about people that are involved in something very traumatic, like a car accident, where not only is their life turned upside down, but life as they know it has significantly changed due to this traumatic experience? How can hypnosis not only help with pain, but also help with the trauma involved in whatever it may be, a car accident, or whether it's a vicious attack?
Indeed. Well, in that case, we're dealing with a multi-layered situation. Generally, there would be some post-traumatic stress disorder, whether or not it was a car accident or some kind of an assault. There would be certainly more acute pain in the beginning. There would be healing that would need to be incited, and we can certainly help with that, and that's something maybe we'll chat about in a moment. But I think the most important thing would be to, again, early intervention, because if we can get to that person soon after this event has occurred, we have a much better chance of stabilizing brain chemistry and also promoting healing if there is a brain injury. Now, it's only recently been revealed that the brain, in fact, does heal. The old way of thinking was that, once there was a brain injury, that was it. Not true. The brain it's the neuroplasticity of the brain, and hypnosis is something that can incite healing on every level, on every part of the body, including the brain.
Now, another fascinating phenomenon with pain that I've come across in speaking to many pain specialists such as yourself is, for example, if someone breaks their leg and long after the wound is healed, the body is still sending the pain messages. For some reasons, it's caught in a loop.
Yes.
So how can hypnosis help to get rid of that sort of phantom pain that people are experiencing?
Yes, I think what you're talking about generally occurs after the pain has been very active and very profound for a period of time. Now, exactly what this period of time is under great dispute. I personally think it can be as little as 2 days of super acute pain, whereas a physiotherapist that I often collaborate with says it must be 12 weeks. Whereas the medical doctor that I go to says there is no such thing. So, lots of opinions there. But again, what we're dealing with is the limbic system, the secondary nervous system is what's responding here. And again, through hypnosis, we can speak directly to the secondary nervous system, which is what gets suppressed with pain medication, by the way. That's what they're suppressing, the secondary nervous system. And that's what is still responding when you have these phantom pain circuits going. So just in the same way that we would work with someone who is in acute or active pain, we can work with the individual who has had long-term pain and is having these unusual neurological effects of an echo, if you will.
Now, I know hypnosis can also be used to prevent pain, because I know many a brave hypnotist who has gone into surgery with no anesthetic.
Yes,
they
indeed.
Like to try these things,
yes,
don't they,
they do.
I'm not that brave person.
Nor am I.
So we know it can actually prevent pain to the point where you see people getting their wisdom teeth. I know a hypnotist who had heart surgery, God bless him, without any pain medication or anesthetic. So how can hypnosis help with, excess bleeding after surgery, recovery times, to lessen the pain after surgery?
Well, all of that is really compellingly responsive to hypnosis. In fact, in our practice here at Bloom, we have protocols and modalities that we do with the client before surgery and after surgery. So if someone is about to go into surgery, one of the things that is always key is we tell the subconscious mind of our client that they will not bleed excessively. Because one of the things that can make surgery more difficult and make recovery more difficult is excessive bleeding. And that can be so controlled. I actually use that on myself before surgery with self-hypnosis, and after I was in the recovery room, I asked the doctor if everything had been, remarkable and or normal, and he said, "Well, the unusual thing is you absolutely refused to bleed." So we can make things really amenable for the surgeon. And then on the other side of the scale, after the surgery is over, we can, again, by speaking to the subconscious, by speaking to, by creating fibrinogen and all the things that people need to heal, we can speed up the healing process. Some people say as much as by 50%.
Well, I know they've taken a stopwatch with bleeding, and they've actually cut down the bleeding time in half.
Oh, yes.
This is something that they do when they're testing, people's
Absolutely.
hypnosis skills. Now, what about, because I know that there's some very harsh diseases like cancer, where not only is the person experiencing the pain and the trauma of cancer, but things like nausea or burns from radiation. Tell us about hypnosis for those side effects.
Well, all of that can be greatly minimized with hypnotherapy, as you might imagine. And also, one of the things that we do in pain management is we are able to deaden areas. And I think that's what you were referring to a little bit earlier, talking about dental hypnosis. And I myself have scrubbed up and gone into operating rooms for people who are not tolerant of anesthetics. And I've been able to deaden an area for a procedure such as a spinal tap. I've never done anything like, assisted in anything like heart surgery, but certainly for a medical procedure that involves serious pain and the person cannot tolerate anesthetic, we have techniques where we can actually create numbness and freeze certain areas of the body, whatever we choose. And then if we're working with someone on an ongoing basis who has specific areas, for instance, radiation, as you mentioned, we can teach them how to move that feeling of numbness and freezing around to wherever they need it.
Right, so a form of self-hypnosis.
Indeed, indeed. And as we've said, as you've said many times, all hypnosis is really self-hypnosis. We're the guides, and we are specialists in the language of the subconscious mind.
Excellent. So if you were to leave our audience with anything that you'd want to empower them with the notion of hypnosis for pain, what would that be?
You are not a victim and should not be thinking like a victim, because you are actually in charge of how you feel. And once you understand that you are not enslaved to either the pain or the medication, we can move forward in a healthy way as a complementary treatment to whatever your medical process is, to make you comfortable and reduce any levels of toxicity associated with opiates, or reduce any possibility of opiate addiction. And we can do early intervention. We can get in there and put a halt to these pain processes before they become a learned response.
Excellent, Leslie. Thank you so much for being here
Thank
today.
you, Dee Dee. My pleasure.
Thank you.
Thank you.